um, youth and gangs, and the vast majority of young people are not involved in gangs and want nothing to do with them. However, the behavior of a small number of young people who are involved has significantly impacted on the community and the families and the society as well as themselves. Um, this is something that as well, when we talk about the society, when you talk about gangs, mental health, the things that all of these things have in common. One is a fear of basically of emotions, like emotion literacy. A lot of us in showing how you feel, expressing how you feel is something that we're afraid of because we're not taught how to navigate with emotions in general. Emotion is something that everybody runs away from, because it brings up so many things, so many complications. So that is emotion literacy. I think is one of the biggest issues that faces our society today. Then you go basically making yourself feel vulnerable. So if you talk about your feelings, you're gonna have to make yourself vulnerable, and we're afraid of that because that brings up uncertainty and makes you feel powerless. So that's another reason. So you got the feelings, then you got sense of vulnerability, which brings up so feeling brings up the unknown. Vulnerability brings up uncertainty and feeling powerless. And afraid, the biggest one, afraid of rejection. And this brings up feeling making you feel weak and needy. All of us don't want to feel weak and needy. And the uncertainty of that, it can really make you feel powerless. Being basically rejected is so painful that a lot of us would rather suffer in silence than be rejected. So this can sometimes brings up a sense of loneliness, sense of the other person you have more power than you. So this sense of why gangs issues in Somali community and mental health is a lot bigger than what it is a taboo, because there's so many unknown variables within that. What is the reason why young people join gangs? So young people join gangs for reason which makes sense to themselves, if not to adults. Some reasons why young people join gangs are basically respect and status, to gain friendship, sense of belonging, excitement, peer pressure, and to find a suitable family, power, a suitable family, sorry, power, protection, and money. So again, the way I look at it is that what I just discussed right now, this sense of emotion being an alien concept, not understanding what emotions are, you know, um, and one of the things that a lot of young people don't understand is, even us adults don't understand, is that the difference between self-esteem and self-confidence. Now, most of us, when we talk about self-esteem, is I feel good, is a lot more complex than that. So self-esteem is to do with your emotions, and self-confidence is to do with your basically your thinking. So they're two different things. So sometimes the way you think, we talked about mental health within young people. They knew about mental health, but there was a sense of like betrayal within the family, not wanting to talk about it, the stigma, all of that. So there's a conflict between what they know and what they believe. And this is the same thing with young people. Like they see this glamorized, being outside, being liked, and everything else. But if you're not in that group, you're segregated. If you don't have a sense of like belonging, sense of self-esteem. And why is self-esteem important? Because self-esteem refers to positive evaluation of oneself, a feeling that one can overcome life challenges and is worthy of happiness. Now, that might seem very simple, but it's a lot more complicated now, because that is related to, you have hope within yourself, not hope on others. You know that you can overcome something, so you have belief that you can overcome something, and you're comfortable within your own skin, so you can able to stay in a place of uncomfortability because you know there's a better thing coming up. But if you don't have that sense of concept who you are. You don't know how you think, what your thoughts are. You don't know where your feelings are, where you want to be. And a lot of young people, these are the things that they're struggling with. So they will find their own way to fulfill that gap. And this is a failure as a society to understand the importance of teaching young people how to think critically. Mental health in youth. Mental health problem affect about 1 in 10 children, 1 in 10 children and young people. They include depression, anxiety, and conduct disorder. And conduct disorder are often direct response of what's happening in their lives. So again, when we talk about conduct disorder, is about taking risk. Everything we talked about, when you join gangs, you're trying to fulfill that sense of like happiness, belonging, everything. But when you join a gang, it goes against everything that society tells you. So that is called conduct disorder, taking risks, stealing, robbing, all of this. So they cannot outweigh and make the risk of what is happening and the long-term future. They're stuck in the present, what they need now. That overpowers them, so they cannot think critically. And what we need to teach our young people critical thinking so that they can navigate life life challenges and accept responsibility of their action. This is not something, the best way I can describe it is that you're born. From the day you're born, from the day you get 5 years old to the day you're 25 years old, you're studying for university. But how many times do we really step back and look at ourselves and analyze ourselves and think, who we are? The successful ones are those who are patient and contemplate. We don't have time to contemplate. People don't have time to be themselves, and this is why mental health is so high. You know, mental health is like, you have people addicted to about 450, 420 million people worldwide addicted to what? Mental health. And alarmingly, however, okay, we still deal with mental health in young people. So alarmingly, however, 7% of children and young people who experience mental health problem have not had appropriate intervention and intervention in early age. So again, it is a lack of funding, lack of intervention, and this is not only about professionals only. We're talking about schools, we're talking about society, we're talking about communities not putting in place a way to cater for young people, a way to nature young people. It's like we want everything to be done yesterday. Everything has to be fast. Mobile phone has to be fast. Everything. A young people, we don't have time for children to slow down. We think they're dumb. We don't see that as basically, okay, if a child is slow, that means they can memorize better. It's that thing, when they learn, they will never forget. A child can learn something quick, but they can forget it quickly. So everything has positive and negative. This is another thing that, schools at the moment are overcrowded. The last 20 years at the moment, since conservatives came, youth club has closed. Support network for schools, mentors, nurses, when you're talking about and teaching assistant, all of these things has been cut down, but yet the need of the teachers, like you have so many young children from all over the world coming in the schools has grown. So all of these issues is impacting on children environment. It is normal for children and young and youth to experience various types of emotional distress as they develop and mature. While most youth are healthy physically, emotionally, one emotionally, one in every 4 or 5 youth in okay, one in every 4 or 5 youth in the general population meet the criteria of lifetime mental health disorder, and as a result, they may face a long-term arduous road to recovery without appropriate support. And this is about, when you look at mental health. is something that at the moment is so overwhelmed. You have to wait for 6 months to get an adequate mental health support. You put the stigma on top of that. And this is the thing about, I was just talking about a second ago, about when young people are showing distress, anger, not able to learn at school. You know, we see that young person as a troublemaker, as not or defiant. But this is a cry for help most of the time, and we need to change the mentality of, if a child does not do what they're supposed to do, then we need to discipline. Sometimes we need to learn what is called unconditional positive regard, open-mindedness, empathy. We need to show this to our children, because if that is not there, how can a young person able to contain their own emotions? Um, for example, it's common for children to experience anxiety at school, in youth club, in youth club, and for a period of depression at transitional age. So for a period of time, it's normal for young people to experience this, because this transition is in nature. Transition means when you're transiting from one situation to another, you're generally gonna feel anxiety. But if those systems are persistent, it may be time to seek a professional help. So how do you know what is persistent mean? So what we're talking about is, um, in general, if a young, how do you diagnose? Sometimes you can say there's something going on with a child or an adult. So if they cut their friends, they lost weight, they're not performing in school, they're getting angry, the relationship has deteriorated. If this goes over several months, minimum should be 3 months, then you know that something needs to be learned to change, or it needs um, intervention. But sometimes it's young person a bit moody, they're alone in their room, but they're still doing what they need to do. We need to have conversation with that young person, so we can see specifically what's going on with them. As with physical health, mental health is not merely an absence of disease or mental health disorder. It includes emotional well-being, psychological well-being, and social well-being, and involves being able to navigate successfully complex of life. So when we talk about navigating successful complex of life, one of the most important thing is teaching young people self confidence, self love. The best that you can be is yourself. There's a word that I use in my classes, a motto. I say to them basically, as long as you try your best, you are the best, and the best that you can be to yourself. What does that mean? If you try your best, that's all you can do. You accept that. And if you try your best, you are the best. Somebody tells you, how are you the best? The best you can be is yourself. It's about telling them and teaching young people that, life is gonna be hard. You're gonna be disappointed. But as long as you know that you have tried your best, and you can learn that there's a learning. If you haven't done your best, then what have you done? Where did you fail? What can you do differently? This is about teaching them the complexity of life, how to navigate life, develop fulfilling relationship. Again, it's about showing them how to be vulnerable, how to ask for help, and teaching young people that asking for help and being vulnerable does not make you weak, it actually makes you strong. So the confident person is the one who's able to ask for help. The person who cannot ask for help, that's the person who's not confident within themselves and within their own skin. So changing the narrative again, adapting to change. So about teaching them, change, there's always anxiety with change. There's always difficulty with change. But through the change, only by going against your anxiety, you practice your freedom. Learning appropriate coping mechanism to achieve well-being without discrimination. So again, it's about making sure that everybody is treated as an individual with individual needs. So able to understand what stigma is, discrimination is, and teaching them that this exists and this will happen in the world. So the world is not perfect hunky-dory, but they have to be. Not everybody's gonna love them, but they need to stay steadfast to what they need to do, and real life um, opportunities. Have your needs been met? Again, and how is the needs of a young person being met? Is about not automatically when a situation arises, especially those of us in professional situation. It doesn't matter what caliber or even as parents, not jumping to conclusion, but always asking. Even when you see something is wrong or it's not been done properly, don't jump to the gun. Ask, what's going on? I can see the way you're behaving. It's not it's not basically, how do you say, correct. So what is going on with you? What's happening? Why are you angry? Why are you upset? And after listening to that young person, what they're saying that's meeting the needs, then you can say, this is the way it's supposed to be done. We already had this conversation. You know what you need to do. But always open that channel so they don't say but let them say whatever they need to say, and then afterwards giving a feedback and develop the skills that help you to navigate a difficult environment you inhabit. So again, giving young people, as we talked about, the necessary skills that they can overcome whatever situation they're in. So for example, we know that one of the biggest problems right now is internet addiction. So how does that affect you? So when everybody, generally, when you're watching a movie or playing PlayStation, if somebody interrupts you, you automatically get angry. When you've been watching internet for such a long time, after you come out, you're irritated, you're angry, you're you're tired. It's about showing people, especially young people, how that affects their daily life. So these are the triggers of a daily habit that happens, the cause why sometimes situation or relationship and kind of goes down the spiral. So we need to show things that they're not aware of that can cause harm or difficulty in their lives. Mental health in youth, and the presence or the absence of various combination of protection and risk factors contribute to the mental health of our youth, um, of our youth, and it can be undertaken to promote a positive mental health and prevent or minimize mental health problems. Youth with mental health disorder may face challenges in their home, schools, communities, and an interpersonal relationship. So, you know, this is something, again, we just talked about how, this just summarized everything I said. Is not one place that needs to change. Is that young person needs to be catered for and to be helped in navigating those situations. So most of the time, it's not about when a young person, I kind of feel, when a young person tells me a problem, I see an opportunity of learning. But if you see a situation, I think the word problem I don't even like. I'd rather say challenge. When a young person shows a situation of, he had a challenging day, I kind of say, how can we overcome this? What have you done wrong? Remember last time this happened? It's not different than this time. It's about teaching them what is going on every day to the point where you can change the narrative, the words, the negativity that's going into their mind into positivity. So every day is a learning curve. So we're all students, we're all gonna make mistakes, and life is not different. When you're students, you a good student is the one that thrives in making mistakes, love to make mistakes because they know every time I make a mistake is a chance for me to learn. And we need to change that mentality with our children, with our young people, give them that positiveness that we all make mistakes. The problem is not making mistakes. The problem is, and seeing that failure, that moment of setback as as a as a defining moment of your life. By changing that narrative, saying, you know what, this is a chance for me to see where my capabilities are, where I need to improve. So changing that in their mind and showing that positivity is what we need to do. So we need to change how we view ourselves, our lives, and how we live our lives. So, and thus we can empower others. Um, Despite these challenges, for most youth, mental health disorders is an episode, not a permanent. So an episode means it's just a momentary thing. Okay, most can successfully navigate the challenges that comes from experiencing mental health disorders with treatment, peer and professional support and services. with a strong family and social support network. 100%. Easier said than done, but and that's what we need to do. Being aware and not afraid to talk about vulnerability. And I think we can all we can all learn to share our vulnerability. We can all share because we cannot expect our young people to show vulnerability when we're not willing to share our own vulnerability. And I think that's one of the best keys of of connecting with people is sharing your own challenges and failures and say, you know what, my failures are the best part of my life because wisdom only comes from pain. Success only comes from failure. It's about encouraging to to go in the deep end, encouraging to learn because learning you have to fail, and we need to put that spirit of go live. Don't be afraid. It's okay to fail. No one is perfect. Again, this is the issue that we have, and everybody wants to be perfect. This when you talk about Instagram, Twitter, all of these movies, is encouraging perfection on top of the world. But nobody, when you talk about all of this fitness, 10 years, 20 years, they're building their body and you just see the outcome. But you don't see how they got there and you're just beating yourself up. But it's about teaching them how long it took. It's about seeing what consistency means. It's about teaching and learning within ourselves, atomic habit, how little habit can change our life. It's not the past or the future that defines who you are, but the present. What you do today is who you're going to be tomorrow. And Islamic context of mental health. So this is spiritual resilience. Islam offers a spiritual and sanctuary for Muslims to live a fulfilled life by using their inner strength and having a strong relationship with the ultimate power, Allah. Being optimistic, purity of purity of their feelings, purifying their feelings, and not waiting for outside event to improve. Islam acknowledges the importance of spiritual state as an integral power of integral power that we can be exercising to have a calm mind, a healthy connection, and a positive thoughts. So spiritual health, being in a moment, and what I like about being Islam is the most important thing. It encourages us to be in the moment. That change your environment doesn't have to change, but your inner self, yourself, you change yourself. You know that no matter what's happening today, no matter whatever's happening in your life, there's ease. In the ma'al usri, so through every hardship, there's ease. You know, you know, God does not God does not burden you more than what you can handle. And it's about encouraging that and making sure that we understand that as well as Muslims. The role of patience. Islam attaches great importance to patience, and it is the focus of about 200 verses in the Quran, and refers to and refer to that indirectly many others. Patience is a virtue that enables a Muslim to process towards and proceed towards a worthy goal, and 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 and, and deflect by adversity, circumstances, repeated or provocation. So it does not matter if somebody is provoking you. Things are not going well. It does not matter. But what it teaches you says that the successful ones are those who are patient. Allah Subhanahu wa Taala said to the Prophet, and fasbir sabran jamilan. Show beautiful patience. And this is a person, this is the Prophet ﷺ that was commanded to show beautiful patience. So how much do we need to be patient with ourselves? To be patient in what we're going through, to understand that whatever we're going through, we're not alone in that. There's many other people in similar situations as us. Evil eye. The context of mental health. Islamic context of mental health. Belief in evil, belief in the evil eye is founded in the Quran based on the following verses, and from the evils of our from the evil of the envier when he envies al falaq. So, and from the evil of the envier when he envies, Surah Al-Falaq. So this surah came down when the Prophet himself was afflicted by 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 uh, by envy and sihr. You know, this is the surah that helped the Allah Subhanahu wa Taala brought down. The concept of evil eye is believed that an individual can look at a person, animal, object, and cause it harm due to the jealousy. So as a Muslim, we're taught to always purify, use basically dua protection to protect us from that. But what it does that as well, it kind of connects us spiritually that we have no control over certain things. We have no control of what is going to be, what is going to happen to us. But only through the decree of Allah can this happen to us. And it's about believing that whatever's happened to you, you can overcome it. It doesn't matter what's going to you, but it does not take away your spirit. The belief in jinn has the power to, we believe that jinn has the power to possess an individual and cause them harm to cause harm to the person and those around them. So this again is about jinn. Jinn are, you can call them how do you say, spirits, okay, ghosts or whatever. So they have the power to possess, but at the same time, even though they have those power, only through the decree of Allah can they harm you, or this can happen to you. So we were told that whatever has happened to you is decreed by Allah. But what is necessary for us to remember is we in this world as Muslim, we believe that we're going through a test, and this test is to see who amongst us is worthy of of the pleasure of Allah. So everything we're going through, we're taught to be patient. We're taught to be thankful. We're taught to always be in the moment, and you know, it is the present that counts more than anything else. More than your past is what you do today that counts. And I think that's the biggest key to go against anxiety. And and this is what we need to learn as Muslims as well. And we can take a lot from these verses and its understandings. And a lot of Muslims, this is what keeps them together. When I work with a lot of through my experience, one of the biggest things I heard is I can never commit suicide because I don't want to please my Lord. No matter how sad I am, I can never go beyond a point where I want to commit suicide. And I think anything that can help you to kind of be in the moment in that kind of context is a beautiful thing. Mental health is a taboo subject in a Muslim community, and leaders. Mental health is a taboo subject in a Muslim community. It leads to embarrassment and fear of the or fear for the members of the community who do have mental health illness. This is a serious issue that needs to be addressed so that those suffering can get mental health can get the help that they need. One of the things that we did regarding this, we did it several years ago. I did a video that's called Mental Health No Sihr, and it talks about that mental health um, is not it's not because you're bad. It's something that is an illness like any every other illness, and you need to seek the necessary help. So if it's a spiritual thing, you need to go to those spiritual leaders. And if it's a mental issue, you need to go to professionals. But the best way of combating this as a Muslim is to go seek both help, because it does not, they're not gonna clash, because one is spiritual and one can be emotional and mental, and it can be drugs if you need to be taking drugs. It does not go against by using every aspect, every tool necessary, physical and emotional and spiritual. All of this can help you to make you more resilient. The misconceptions in the Muslim community. Another misconception in the Muslim community is that mental health is associated with being non-religious or not religious enough. Many factors may contribute to the developmental of mental health issues. So it is not fair to over oversimplify a multifactorial medical condition because it is dismissing the potential role of mental health profession in helping. And this is true because when you this is one of the reasons that we talked about the taboo of Islamic in a Muslim community, because what we just talked about, that increasing your spirit, increasing your religious practice, connecting with Allah, it is basically could be a reason why your mental health can decrease. There is a part of that, but that cannot be the only issue. So we have to look at it as a holistic thing, not one glass fits all. We have to look at it in a many concepts that somebody can, maybe they don't have a spiritual issue, or they don't have sihr, or they don't have jinn. It could be a mental health issue, and we need to able to look at it as a multifactorial thing, and able to go to the mosque to seek help with the religious, and for you to work on yourself, to go to counseling, to do your physical exercises, to and walking on the park, to and go with your friends, is something that is a life-changing thing. Many Muslims believe that today's mental health issues are tests from God, and they are therefore not addressed. Of course, that can be said in every aspect of life. As Muslim, we believe that Allah created man and jinn to worship people alone. So in life itself is a test. Everything in life is a challenge. So that cannot be the only way. But we need to able to address, to look at the things, to look what is really going on. And if you look at from an Islamic perspective, Allah subhanahu wa ta'ala said that every prophet that he sent, he gave them and wisdom and knowledge and wisdom. So we have to seek that knowledge and wisdom for us to overcome whatever we're going through, because Allah doesn't burden anybody more than what they can handle. So what we're missing is the wisdom to able to get to where we want to be. So that we believe in Islam that there's a cure for everything. So find that cure, and that cure is going everywhere that you need to go to seek the help that you need. And you know what help that you need. Do not let other people dictate what you need or who you are, because you know yourself more than anyone else. The misconception of Muslim communities. A non-Muslim health profession is going to impose their belief on you and see and this and on you, and this is going to undermine your Islamic belief. A professional and an ethical objective of all mental health profession are to respect your values and belief. If if a Muslim, or you're spiritual, is an important integral fact in your life, you should have an open discussion with your therapist or counselor. So basically what this means is that, if you're religious and Islam is an integral thing, you need somebody who can understand what Islam is, who can understand where you're coming from. And it's called the unspoken. Sometimes you might have, when I see a lot of when I see even people who are Muslim, sometimes there's misunderstanding of Islam. And we talk about when you suffer from mental health is a punishment, is because you're not religious enough. And that's not the reason. That's not the reason. So these stigmas sometimes can stop people from seeking help. And if you go to somebody who does not understand the religion, they might give you and not understand completely what you're going through, and you might not explain what is going through. It is good to have. I'm not saying somebody who's not a non-Muslim cannot help you, but it is better to be safe than sorry, especially if you're very religious and spiritual in your religion. It's best to seek somebody who knows that as well. But at the same time, there could be somebody that you can go to and not able to see your point of view. But most professionals do work ethically and try to accept you unconditionally. As with any profession, you may you may like some counselors better than others. And if you have or had a bad experience with a counselor or therapist, there are literally thousands of other counselors you can turn to and may offer a better service. That's so true. If someone has faith in Allah, they shouldn't be depressed or have a mental illness, should they? Very good question. As a Muslim, you get affected by life troubles and lifestyle and have bad thoughts, like everybody else. But you can deal with this. You can deal with them much better because you have a clear roadmap of where you're coming from, where you're going, and why. So you have a head start having this foundation knowledge from a source. Someone who feels completely lost and alone in the face of this crisis would probably feel hopeless and depressed. But someone who feels supported by a compassionate God, who genuinely cares, who listens to desperate pleas, okay, and and who grants generous help, has a better chance of getting back on track much faster because there is a strong helping hand reaching out for while you're dealing with life troubles. And this is about Allah subhanahu wa ta'ala, do not despair. Don't despair. Don't look at the world as a there's no light. Allah subhanahu wa ta'ala says that I am whatever my slave thinks of me. This is about, in another way, this is about having mindfulness. It's about having positive thoughts, using affirmation. So whatever you think of how you think the world is going to be is how you feel the world is going to be. How you project it is how it's going to be. Well, we do not see the world as it is, but as we are. So if you believe that you deserve, and you're able to cope with life, complex and challenges and worthy happiness, that's how your life will be. And it starts within yourself. Believing that. And these are the references I use for this section. So hopefully you guys gonna go and look at the references and hopefully get more information. Thank you for joining our session, and hopefully we're gonna see you on the third one.